Help's coming, guys. Don't worry.
These are the emergency calls made moments after Kevin Hart's vintage muscle car careened off an LA road.
He looks like he's hurting.
The caller describing the chaotic scene early Sunday morning.
Sounds like the passenger's stuck in the car. The driver is out of the car, but he looks a little hurt. I think the top of the car is crushed.
At 2:15 a.m., a woman identifying herself as Hart's wife called 911 from their home.
He was in a car accident earlier tonight, or what happened?
Yes, earlier tonight. I don't know what happened. He's not coherent at all.
Did he get treatment originally from when he was injured? Did he go to the hospital, or?
No treatment at all. We're just here, and he can't move.
Is there any obvious broken bones that you can tell? You see anything broken?
Just something on his back is pulling out on his spine.
So actor and comedian Kevin Hart was recently involved in a serious car accident and suffered spinal fractures and had to have spine surgery. In this video today, I'm going to be talking about Kevin Hart's injury of his back, as well as the surgery that he possibly had. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So Kevin Hart, a couple months ago, he had a really bad car accident where his friend was driving the car flipped over and rolled into a ditch, and somehow he got out of the car and walked to get some help. His friend that was in the car, along with his fiance, were extricated. They had to have the EMS workers and paramedics physically remove them from the car. So it was a really serious car accident. And there were a lot of reports about maybe this was made up, maybe some news outlets out there just came up with this story. There was also some reports that Kevin Hart was paralyzed, and when I first heard it, I just didn't believe it. But it is actually true. Kevin Hart did have a serious back injury that required surgery, and we're going to talk about it in this video today. The reports out there state that he had about 3 fractures in his spine that required fusion of his spine. Let's check out the video.
It left his spine fractured in 3 places.
So as you can see from this part of the video, that the care workers, the healthcare workers, maybe they're a nurse, maybe a physical therapist, occupational therapist, they're helping him get up from a seated position. And this is pretty common with patients who undergo spine surgery. It's a major operation. He's wearing a brace that is covering his thorax as well as his lower lumbar spine. And he has a tube in his nose. That's essentially oxygen. It's a nasal cannula that can deliver small amounts of oxygen to patients.
Kevin shared an emotional video on Instagram, updating fans on his health and how long his recovery process will be.
You can see in this portion of the video here that he has an incision at the mid portion of his lower lumbar spine, and the little shiny area that's over the incision is called dermabond. It's actually glue that we put after we close the wound to keep the wound closed. The location of his incision helps a lot because that tells me his injury was at the thoracolumbar junction. The thoracolumbar junction is the transition zone between the thorax and the lower lumbar spine. The thorax is really rigid because of the rib cage, and the lower lumbar spine is more mobile. So this transition zone is actually a very common place to have a fracture because of this transition. One of the more common fractures in this region is called a burst fracture. A burst fracture is usually a fracture that causes the bone to weaken by a significant amount of force. Usually it's an axial loading force that causes the bone to weaken, and all 3 columns of the vertebrae fail. So if we look at a model here, this is the vertebrae here, and this is the 5th, 4th, 3, 2, 1, the first vertebrae. Say for instance there was a burst fracture here. Usually in a car accident where the patient is ejected or their car has rolled over, that's a lot of force that can be applied to this area here and to this bone. When that happens, there's an axial loading to this bone here that causes the posterior column, the middle column, as well as the anterior column to fail. Another potential injury that he may have had is called a chance fracture. This is when patients wear seat belts and the seat belt causes the patient to flex forward, causing significant amount of force applied to this anterior column of the vertebral body. That seat belt is designed to prevent you from getting ejected from the car. But the downside of that seatbelt is that it allows a significant amount of force to be applied to the anterior column of the vertebrae. If Kevin Hart had a burst fracture and did not have any neurological symptoms such as numbness or tingling or weakness in his legs, well, there are several studies, landmark studies in spine surgery, that state that we can treat these patients who have burst fractures without neurological deficits without surgery, and they do just as well. So either a burst fracture with some neurological deficits or a ligamentous chance fracture, that usually requires a spinal fusion. If you think of it as a big picture, the two main reasons that spine surgeons operate on patients in a trauma setting, if number one, there is instability. If there is a fracture or if there is compression or instability of the vertebrae that causes the vertebrae to either move backwards and these two bones here separate, called the facet joints, or move forward and then the vertebrae above and the vertebrae below that are unstable, well, that usually requires a fusion. A fusion is when we go into the spine to stabilize that spine with rods and screws until that portion of the bone fuses together and does not move anymore. This is usually done with rods and screws. As you can see, there's some metal rods here and there's some screws that are going into the pedicles of the vertebral body. This usually stabilizes that vertebral segment of the bone until the bone heals. And most bones in the body, depending on the location as well as the blood supply, usually take anywhere between 6 to 8 weeks to heal. Recovery for this type of surgery can be quite lengthy, anywhere between 12 to 18 months. So let's go over to the video and check out some of his recovery process.
So don't take today for granted, because tomorrow's not promised. More importantly, I'm thankful for God. I'm thankful for life. I'm thankful for simply still being here.
If you look closely, you can see his actual x-rays. So what you're looking at is the metal rods as well as the screws that are in his back to stabilize his back. And this is a typical short segment fusion, which means we fuse a short segment of the spine. So by looking at his x-rays, that tells me that he either had a burst fracture with some neurological deficits or he had a fracture dislocation of his spine. Both of these conditions usually necessitate surgery, a fusion, posterior spinal fusion, and that is essentially what he had done. So I hope this video actually helps explain what Kevin Hart actually went through and what type of surgery he had and what type of condition, injury to his spine that he possibly had. I hope you guys enjoyed it and I hope you guys learned something. And thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.